Hi, Monty Pal here on behalf of GU Oncology Now. Today we're going to be talking about updates in kidney cancer with three of my dear friends. We're going to start with a quick round of introductions, beginning with you, Cristina.
Hi, I'm Cristina Suárez. I'm a medical oncologist at Vall Hospital in Barcelona, Spain.
Dan.
Hi folks, Dan George from Duke. I'm a GU medical oncologist and happy to be part of the panel.
Awesome. Brad.
Yeah, and I'm Brad McGregor, also a GU medical oncologist from Dana-Farber in Boston.
Awesome. All different parts of the world here. Monty Pal from Los Angeles, California, and we're going to dive right in. In the last 2 minutes here, I'm going to put you guys on the spot, but I'll take the first hit. Okay. I'm going to ask you what you think the most exciting trial is right now that's ongoing in renal cell carcinoma. And I'll take first dibs on that. I'm going to actually say it's 304, which is this trial of XL092 Nivo versus sunitinib. I'm really hoping it addresses this void in non-clear cell kidney cancer. If we can bump those recommendations with a choice from a definitive phase 3, I think that's going to be powerful. Brad, can I turn to you next?
Yeah, I think the CONTACT 3 and Nivo 2 are going to be critical. I think this is something that we don't really have the answer. What is the role of continued immunotherapy beyond progression? And so I think hopefully those trials will provide some really important data.
Dan?
I'm going to say pedigree, but I'm going to say not for what you think. Okay, I think, regardless of what pedigree shows as a result, the fact that we can start a different trial design where before disease progression, we can add to a regimen, I think is such an important paradigm. Because when I think about how we're going to make progress in this field, working towards a minimal disease state, whether it's patients that get a deep response or a partial response, we need to find out how to maximize this clinical benefit before they progress. And so I really like the pedigree design for just really kind of a trailblazing trial of being able to show that we can, almost like heme malignancies, start looking at sort of induction or initial therapy and then subsequent therapies before progression.
Makes sense. Cristina, you get the final word, my friend.
I don't want to be biased. I like the 304 trial because I think it's really an unmet need. Like we don't have anything good for non-clear patients, and we really need something, and we really need randomized 3 trials in this population. But I agree with both of you that for different reasons, both are very, very interesting. We need an answer what to do after IO combinations. Pedigree has a very, very smart design. I love the design of Pedigree. So I think I'm not going to say one or the other, but I think every trial is very important in their setting. So
well said. I think we've reached a lot of good consensus here. That's terrific. Yeah. Well, on behalf of GU Oncology Now and myself, thank you, Brad. Thank you, Dan. Thank you, Cristina, for a terrific conversation. Next time we need 4 hours to do this. Thanks a lot.
Thanks so much.
Take care, everybody.
Thank you.